we start with other single ulcers. Other single ulcers include traumatic ulcer. Etiologic agent of traumatic ulcer is trauma from different sources like teeth, danger, accident, etc. It can occur at any age and equally distributed in male and female. And differentiating factor of traumatic ulcer from other ulcers are present with direct history of trauma. Clinically, ulcer is irregular, varied in size based on extent of trauma, and injured tissue tags, and the injured tissue tag will be present along with bleeding and healed once stimulus is removed. And the investigation required for traumatic ulcer is cytosmear, and treatment is removal of the traumatic factor and pain relieving medication. This is the traumatic ulcer. This is the traumatic ulcer. Second is the second single ulcer is malignant ulcer, that is squamous cell carcinoma or minor salivary gland malignancy. Etiologic factor are multiple factors. It is most commonly in the older individual, and males are most commonly affected than females. And classically, a malignant ulcer has a rolled margin and everted edges with a hard base that is indurated and bleed on palpation. And ulcer may have a exophytic growth around and may involve deeper into the bone with hard and fixed lymphadenopathy. Minor salivary gland malignancy commonly seen on the palate, and the investigation for the malignant ulcer is biopsy, radiograph, tumor markers, etc. And the treatment is radiotherapy, chemotherapy, or surgery. This is the this is the malignant ulcer, which has a rolled margin and everted edges with hard base or induration, and it bleed on palpation. And ulcer may have exophytic growth. This is the malignant ulcer. Other single ulcer is deep fungal infection. Etiologic factor of deep fungal infection is histoplasmosis, mucormycosis, plastomycosis, or aspergillosis. Most commonly occur in the older individual and equally distributed in the male and female. And it's very similar to malignant ulcer, but habit. Patient may not give history of habit, and dorsal surface of the tongue and the palate is most commonly affected. And the investigation required for deep fungal infection is biopsy, and treatment is systemic fungal therapy. This is the deep fungal infection ulcer. It's very similar to malignant ulcer, but patient may not give history of habit. Now the tuberculous ulcer. This is the tuberculous ulcer. This ulcer is usually single with irregular lesion with ragged and undermined edges. Minimal duration, but there is a minimum in duration, that is hard bases and with yellowish granular base. The mucosa surround the ulcer will be edematous, and cervical lymphadenopathy is present. Check for other systemic manifestations like weight loss, pulmonary involvement. And the investigation for tuberculous ulcer are Montauk's test, Zn staining isolation, and culture and chest x-ray. And the treatment for tuberculous ulcer is antitubercular therapy. Other single ulcer are canker of syphilis. Etiologic factor is Treponema pallidum. This ulcer is painless ulcer with smooth surface, raised border, and indurated base and punched out edges. And investigations for this is microscopical examination or serological test, and treatment is penicillin. Other single ulcer is non-Hodgkin lymphoma. Etiologic factor of this ulcer is malignancy of the lymphoid cell line, multiple precipitating factors like virus, chemicals, genetic, etc. It most commonly occur in the older individuals and males are most commonly affected. And the differentiating factor is non-healing deep ulcer. This is the non-Hodgkin lymphoma. This is a non-healing deep ulceration with ill-defined border in the surrounding, with the ill-defined border in the surrounding mucosa, mainly on the palate, tongue, or alveolar mucosa. And cervical lymphadenopathy is seen. And the investigation for this ulcer is biopsy, complete blood count, bone marrow aspiration, renal, liver, and chest examination. And treatment is radiotherapy, chemotherapy, etc. Other single ulcer is necrotizing shallow metaplasia. Etiologic factor is uncertain or ischemic necrosis after vascular infarction, most commonly present in the male and clinically characterized by nodular swelling that leads to painful crater-like ulcer with an irregular ragged border mimic a carcinoma, usually located on the posterior palate. And investigation is biopsy. This is a self-healing ulcer. Other next single type of ulcer is traumatic ulcerative granuloma or eosinophilic ulcer of the tongue or traumatic ulcerative eosinophilic granuloma with stomal eosinophilia, that is tuxae. It is caused by chronic trauma. In infant, it is caused by the tongue rasping against newly erupted primary incisor, a condition known as a rigor disease. In infant, during erupting primary dentition and in adult, 5th to 6th decade of life. In children, the ulcers are always on the anterior ventral or dorsal tongue associated with the erupting mandibular or maxillary incisor respectively. In adult, usually on the posterior and lateral aspect, the ulcer generally appear cleanly punched out with surrounding erythema and keratosis if present for week or month. They ranges from they ranges from zero point 0.5 centimeter to several centimeter in size. The surrounding tissue is usually indurated and other sites that may be involved include the buccal mucosa, labial mucosa or floor of the tongue and vestibule. The ulcer is generally appear cleanly punched out with surrounding erythema. This is the tuxae ulcer and investigation required is biopsy should be done to rule out malignant ulcer and treatment is relieve the trauma. Wound debridement also often lead to complete resolution and intralesional steroids injection can be given or laser therapy can be given. Now the differential diagnosis of a case of single ulcer. If the ulcer are recurrent, larger and deeper than herpes, may involve multiple site, oval to round in shape with a history of stress and nutritional deficiency, then that single ulcer is aphthous stomatitis. If ulcer are larger and deeper than aphthe, irregular, with presence of trauma and sharp cusp, then it is that single ulcer is traumatic ulcer. If the ulcer is of longer duration, undermined edges with a weight loss with minimal induration and with yellowish granular base, that is tuberculous ulcer. And paleness ulcer with a smooth surface, raised border, and an indurated base and punched out edges, that is syphilitic ulcer. If the ulcer has a history of nodular swelling before painful crater-like ulcer with an irregular ragged border on posterior palate, then it is that single ulcer is the necrotizing shallow metaplasia. If the ulcer has an irregular ulcer with indurated base and everted edges with or without history of tobacco. Then it can be malignant ulcer or deep fungal infection. Thank you.